Hello, everyone, and welcome to our final day of Wellbeing Week in Law. Thank you so much for everyone who's joined us through the many events we've hosted throughout the week, ranging from coffee talks to mindfulness and yoga to our Tuesday night keynote speaker with Eileen Zimmerman. It's been a fantastic week. Hopefully you found the programming meaningful. I know many of the programs were recorded and will be available after the fact, including this one. And hopefully you also found some value from the Institute on Wellbeing and Law's resources at the national level. And thank you to all of the bar associations participating today who also circulated those resources and programs. So today we are incredibly grateful and lucky to have Michael Curry be joining us to give our final special presentation. Michael is the CEO of the Mass League of Community Health Centers, which represents 52 health centers serving over 1 million patients out of over 300 practice sites throughout the state. Prior to joining the league, Michael worked for 16 years at Blue Cross and Blue Shield of Massachusetts, most of that time as a senior policy advisor in the corporate affairs division. Michael is the past president of the Boston branch of the NAACP and has over 20 years of dedicated service to the NAACP at the city, state, and national levels. He now serves as chair of the National Board's Advocacy and Policy Committee, vice chair of the Political Action and Legislation Committee, as well as a member of the executive and legal committees. Michael served on both the City of Boston's COVID-19 Health Inequities Task Force, Mayor Walsh's Reopening Advisory Group, co-chaired the legislature's Health Equity Task Force, and was appointed to Governor Baker's COVID-19 Vaccine Working Group. In addition, he continues to serve on the Massachusetts Public Health Association's Task Force on Coronavirus and Equity, while also coordinating the Community Health Center's response to the pandemic. Michael served on the boards of countless nonprofits, including the Mass Budget and Policy Center, Mass Nonprofit Network, and the Board of Trustees for Roxbury Community College. He continues to teach as an adjunct professor at Suffolk University's Moakley Center for Public Management and New England Law Boston, where he teaches a course entitled Diversity and Inclusion in the Legal Profession. I myself had the unbelievable privilege of attending and serving as a guest speaker at Michael's class at New England Law in March, and it was an absolutely phenomenal and tremendously rewarding experience getting to interact with his incredible students who are coming up with projects to analyze and think through issues relating to DEI in the legal profession and in legal education. Mr. Curry earned his BA from Macalester College, his JD from New England Law Boston, and was a graduate of the inaugural class of the Executive Leadership Council's Pipeline to Leadership program. And we're incredibly grateful to have him here today to speak a bit about the intersection between the BIPOC community and mental health overall. Michael, turn it over to you.
You, Gavin. I appreciate the invitation to join you. And as I look at the names coming up on the screen, I almost feel like we're in the living room among friends. I see April chilling at home on the call. I see so many other friends. So I hope that this will be, as people say when presentations, but I really mean it, that I'll get through and share some thoughts, and this could be more of a conversation. I think we'll all benefit. And many of you are often invited to speak. You often find out that you get as much from speaking to an audience as they may get from you. And I hope that'll be the case here. So one, I just want to sort of level set us. You know, I was sitting here and I was thinking, I often speak and I start with where we are in this pandemic. And I think it's important for us not to get, as April, I'm sure has heard me say before, weathered to this pandemic and the death toll from COVID-19. I think we've been weathered to this pandemic, and weathered, as folks may have heard me say in the past, is when researchers introduced it to me, they said, Michael, we asked Black parents to rate their kids' asthma from 1 to 10. And we went in, the parents rated the kids' asthma 4 or 5s. Like my mother, I had asthma as a kid. And then doctors came in and rated those same kids' asthma, and it was 8, 9s, and 10s. So 4 and 5s, I should say, the parents, 8, 9s, and 10s by the doctors, the researchers. And what they said is that's an example of weathering. You can get so used to not being able to breathe, so used to missing out on gym and not going to work, so used to sitting in the emergency room once a month or once a quarter that you've been weathered to being sick. So I often put that in the context of COVID-19. Are we weathered to losing family members to COVID-19? Are we weathered to the disparate rates of disease as it's impacted Black and brown communities? And that's not just COVID-19, that's diabetes, that's cancer, that's heart disease, that's lupus, that's the deterioration of our eyes or our mental health or substance use disorder, or it could be police violence or community violence, or it could be discrimination or inequities that exist in education or employment. We've been weathered to a lot of things, but I think right now we've been weathered to COVID-19. So this context, this conversation today around mental health, we can't talk about it without talking about where we are now. So just to give you some quick numbers, because I think, the CNN doesn't put it up in the upper right-hand corner anymore, as they did for the bulk of the last 2 years, but just to sort of level set us on where we are in this pandemic. Worldwide, over 513 million cases of COVID-19, 6.2 million deaths. Now, I don't know if folks take a time to sort of take that in for a second. 6.2 million lives were lost in the last 2 years from COVID-19. And people sort of argue whether some of those deaths were, it really doesn't matter, right? If it was 5 or 6.2. But the reality is we've lost millions of people worldwide, more than we've lost in many of the wars, if not all of the wars, in our altercations over the course of this country's history. 6.2 million people have lost their lives. So just think about that worldwide. And as we talk about the United States, 81 million cases. And we're approaching 1 million deaths, way beyond what we experienced in the Spanish flu. We are now seeing the loss of lives more than 100 years ago with COVID-19. Just here in Massachusetts, 1.6 million cases and 19,000 deaths. It's a lot of people we've lost lives. Those are families that are dealing with the trauma, the impact of losing loved ones. Those are potentially the breadwinners, the providers within those families. Those are grandparents. Those are disparately Black and brown 40, 50-year-olds who were not seniors, who were closest to the disease, as we say, who had comorbidity. So I think we can't start here without talking about that elephant in the room first, which is COVID-19. You'll see behind me Dr. King, who in 1965, as we look up at the screen, says, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. So as we thought, Gavin, about integrating lunch counters and desegregating schools and transportation, integrating transportation, quite frankly, the caboose of that campaign, of that movement, was healthcare. And the reality is many more people were dying of disease at higher rates because we were weathered to dying at earlier and higher rates than any other crisis that we were facing then and now. I would argue, and I say this often, April, many more of us are dying of disease than we are from knees on the neck. But we're not marching in the street about that. And I want you to think about where we are right now. We now have a consciousness, Rachel, that 80% of what drives our health status has nothing to do with the care that you receive. 80% of those social determinants of health, it's the smoking, it's the racism, it's the food insecurity, the housing insecurity, it's all those other conditions that drive our health conditions. And then the 20% or so is the care that we get. And we have to put a marker in this conversation at 20 years ago, the Institute of Medicine put out a report called Unequal Treatment that validated what folks in my neighborhood, when I grew up in Linden Street housing projects, were saying when I was a kid. White folks, white doctors don't treat us the same. They don't medicate us like they do their other patients. They amputate our limbs when there's other interventions for our disease. They don't take us seriously when we think we have a pain in our side. And by the time we find out it's stage 4 cancer, we talked about this for generations. But it took an Institute of Medicine report coming out in 2002 to validate what activists have been saying, truth catching up to history. that there was a taint of race in our provision of healthcare in this country, our access to health insurance. So as we talk about mental health, you can't talk about mental health without understanding its connection to these overall issues of affordability, access, quality, choice, and discrimination within our healthcare system. The reality is, I was looking at some numbers, and these are just shocking to me, just squarely on the issue of mental health, put out by the World Health Organization. 2020, depression will be the main cause of disability worldwide. About 23% of all years lost because of disability is caused by mental and substance use disorders. 800,000 people commit suicide every year. Human rights violations of people with mental and psychosocial disability are routinely reported in most countries. Many low and middle income countries currently allocate less than 2% of the health budget to the treatment and prevention of mental health disorders. Around 20% of the world's children and adolescents have mental disorders or problems. War and disasters have a large impact on mental health and psychosocial well-being. God bless those young people in war-torn places on this planet right now, particularly Ukraine. Stigma and discrimination against patients and families prevent people from seeking mental health care. Low-income countries have a 0.05 psychiatrists and 0.42 nurses per 100,000 people. I mean, these are just some staggering numbers that I just revisited as we got ready to jump on this call. Now we're talking worldwide. We're not even talking about here in the countries. We're not talking about here in Massachusetts, and we're not talking about specifically in Boston where I sit right now. April, I had a chance yesterday to sit with your boss, the Attorney General, at a function at 12 Baptist Church here in Roxbury, organized by campaign manager Jason Burrell, good friend of mine. And April, I mentioned you on that in that meeting. And we were talking about this issue of the Attorney General opened up, talked about her candidacy and what she was thinking about in terms of policy issues. And then she got the chance to hear from the Black and Latinx folks that were in that room about what the critical issues of the time are. And it was a phenomenal meeting where she had the right people in the room, like Tony, who worked for Governor Baker, or BECMA, the leadership of BECMA, Black Economic Council of Massachusetts, and clergy, and I mean, just a wide range of people who brought it. Like, they brought data, they brought concrete policy proposals, they really brought it in that meeting, and I was really proud of the folks that Jason and the team had invited to come to this conversation. Here's why I tell you that. I opened the conversation up after the Attorney General made her opening remarks, and I said, one of the key issues that we have to worry about in communities right now, that is the next tsunami after COVID-19, is deferred care. Now, I know that there's not a lot of conversation on this, Marianne, and you don't hear a lot of people talking about it right now, but we just had 2 years of people not getting their diabetes checked and managed. 2 years of people who could have been diagnosed at a lower stage of cancer who've been avoiding their primary care providers. 2 years of people outside of our healthcare system that have not been treated for disease. And I want you to think about that broadly. We're not just talking about cancer, diabetes, heart disease, and go down the list. We're also talking about their mental health. And if we think the mental health challenge was bad, which is what it was prior to COVID-19, it's exacerbated by COVID-19. And I would argue, when you see those young people attacking people in downtown Crossing, that's a byproduct of where we are with untreated mental health conditions. When you see these fights and these altercations, I would argue in my community where I grew up, Roxbury and Dorchester, that those drive-by shootings was a manifestation of untreated mental health and trauma. Rebecca Lee Crumpler, who was the first African-American female physician of the 19th century. She was a physician, and I say, Rachel and the rest of the women on this call, if you think we have some bad women now, imagine being Black and a woman in the late 1900s and becoming a physician, right? Phenomenal leader from Boston. She had some advice for all of us then and now as she published the first book of medical discourses by a woman. She said, they seem to forget that there's a cause for every ailment and it may be in their power to remove it. They seem to forget there's a cause for every ailment and it may be in their power to remove it. I would argue that you could stretch that and say, maybe they seem to forget there's a problem for every condition and it may be in their power to remove it. It may be, they seem to forget there's a reason for all these social ills in our communities and there may be within their power to remove it. So let's think about that as we have the conversation today about mental health. The reality is, I always say Black don't crack. And I know some of the other Black African-American folks on this call have heard that phrase. We say it proudly, we proclaim it, right? And we talk about it, about the resilience of our skin, Gavin, that our skin holds up in the sun, that we don't get, even though I don't know if that's statistically true about skin cancer, because I think increasingly we are, but we've always touted it as our skin holds up well and the resilience of our skin to the sun. But it was broader than that. It was more than just that. When you heard Black families talk about it in the household, it was about surviving slavery. It was about surviving Black codes and Jim Crow and racism then and now. But I always ask the question, particularly when I get asked to speak before, psychiatrists in training, future psychiatrists at MGH. I always pose the question, I said, Black don't crack, but isn't the cracking on the inside? Because there's no way in the world that you could survive and endure what we've survived and endured and not crack. So I think about Roxbury, Dorchester, Mattapan, Southside Chicago, North Minneapolis, St. Louis, Miami, where no matter where you travel and you visit large populations of Black and brown people, now we know the history. So I don't need with this group. And if you don't, I apologize, because I expected everybody on this call has some base level of history, American history, real critical history, right? About Caste, Isabel Wilkerson's book, Caste. I'm sure you read it. If you haven't, you need to. Or The Color of Law, required reading for this conversation. That's the prerequisite to this call today, Gavin. I didn't give my book list that I need people to read before they come on this call. But the reality is we have to start from here. We need to understand that we are where we are for a reason. So the Black don't crack, but the crackings on the inside is the drive-by shootings, the chronic unemployment. I would challenge all of you in your fragility to spend a day hanging out in Dudley Square, like the Attorney General did yesterday. I would challenge you. I not only just Mass and Cass, I want you to just hang out around Mass and Cass for a few hours. I want you to sit for a few minutes in Dudley Square, and I want you to watch how Black is cracking on the inside. If you're doing some travel, I want you to go to whatever city you're headed to, and I want you to watch how cracking is happening in those cities and towns. And there is a history to why people crack. I think just as we sort of tee off this conversation, I can't have this conversation without reflecting on the many individuals in my life and in my circle that I know are cracking. They're cracking at your law firms. They're cracking in your legal departments. Racism is heavy. That's a heavy burden to bear. So imagine on top of being young or older, on top of the demands on maybe working for a major law firm or even a smaller practice, imagine the inequities in our system that Attorney Jerukum presented to my class when she came as a guest speaker and talked about what it's like to defend young suspects who've been arrested or jailed because they've been thought to commit a crime and they're under pressure to cop a plea. As she tells the story of even my nephew, who many people on this call may not even remember the story, but young African-American man was walking from his mother's house to his girlfriend's house, no more than not even a quarter of a mile. And the police, as he walked up to his girlfriend's house, rushed him, held him as they drove a witness by to say whether he was the person who had just about a mile away shot a Cape Verdean man next to Dorchester Courthouse and had murdered that man. And the vague description, I think it was of a black man in a red hoodie or something like that. So that young man they arrested about a mile away was my nephew. And when they snatched him up and they brought him in and charged him, Gavin, this is the beauty of being former NAACP president, of having access to then Mayor Walsh and the district attorney and Commissioner Gross. And as you know, there's great privilege that comes with being an advocate and having a voice. I was making phone calls within hours. I said, wait a minute, there's a camera outside of his house that will show he wasn't anywhere near the shooting. You need to talk to his mother because she can give you her account that he had just walked out of the house. He couldn't have committed a robbery and murder. But that's not how our system works. So Attorney Jerukum or a young man named Sincere, who I'll tell you about in a second, tells this story. So Attorney Jerukum says, Michael, she got involved immediately. I'm trying to get the police to pull the video. I'm trying to get people to realize this is the wrong young man. He sat in Suffolk County Jail for 6 weeks. Now, I know that this may not even shock some of you because of the work you all do, but I need you to understand how traumatic it is to be a kid who has navigated, like I did, away from the violence, away from the drugs, and maybe by a few seconds left the street corner, or by a few minutes left before the drive-by shooting, or when there was an altercation between my neighborhood and another neighborhood, I was able to walk away instead of grabbing a gun or a knife and getting involved in the altercation. I need you to understand that this young man had avoided that life. I need you to understand the trauma, the resilience that's packed into his life experience to have survived that, and then to be stopped on the street for murder and have a system that doesn't believe you, and to be jailed, and to know that no one, maybe even your family, doesn't believe you. So I think about his story. I think about Sincere, who is a brother that probably many of you have never even heard about, April, but I want to tell his story real quick before I sort of wrap it up and we can talk more in detail. Sincere, his original name was Darnell Venable. Darnell, when the Million Man March happened in 1995, had come back, was coming to visit his father, a very prominent community health worker. Darrell Fox is his dad. His grandmother is Gloria Fox, Representative Gloria Fox. And Darnell was living with his father in Virginia, had come back to Boston to visit and to kind of hang out with his dad and his other brother. And during the Million Man March, he got connected to a lot of us who were activists and organizing around changing our communities. And he became our little brother. So folks know Glenn Lloyd of City Fresh Foods and of Eastern Banks Foundation. He was on that group. I mean, some very prominent young leaders at that time in our 20s and early 30s were his older brothers and sisters. Darnell left to go back to Virginia to visit family. And then a few months later, we got called. He was 17, really good kid, super smart. We were told that he was arrested for murder in Virginia. He was facing the death penalty, and there was nothing anyone could do. And of course, we were all traumatized. Of course, the Fox family, former State Representative Gloria Fox, Darrell Fox, and all of them were calling around for all of us to write letters to talk about his character. Darrell served, and I'm probably going to mess this number up, over 20 years in prison. And I don't think anybody believes Darrell committed the murder. Now, he may have been involved in some way, but the injustice of our criminal justice system was he didn't actually commit the murder. And the person who actually committed the murder, likely in his case, didn't get any time or very little time. But that's our system, right? That's how brokenness of our system. So I want to get back to my point when I say you can't intersect and you can't engage with our system without carrying some trauma. Now, if you're white on this call and you work in Roxbury District Court, or you've been in Dorchester Court, or Brook Courthouse, and I think about Sharice Perry, a good friend of mine, you may walk in and everything is transactional to you, and you take a case, whether it's a child support case or a murder case, and you do the best you can, maybe, and you try to dispense with, whatever your role is in that case and have a outcome that's favorable. But imagine the weight if you're Black and you're Latinx and you're representing that client and you're carrying the weight that this is like your little brother or like your cousin, or you're connecting that person's circumstance to the broader issues in society. I've had this conversation with U.S. Attorney Rollins many a times, right? That's why we've been waiting for sort of disruptive leadership. I said that to Attorney General Maura Healey yesterday. I said, Attorney, we can't keep waiting on bold and unbossed Black and Latino folks to change systems. Right? We need allies who come in, like the Marilyn Mosbys, and I can name them, even some white prosecutors across the country are doing disruptive things because they understand that the system was always broken and it was always marginalizing and penalizing and incarcerating and damaging Black and brown folks, Black lives. So I want to just lift up the Black attorneys, the attorneys of color who've been in this work, who endure the microaggressions, the trauma of being in this space, and whether it's from their colleagues or whether it's from the weight of the struggle within their institutions and within the broader society, that work is hard. That's the cracking that we're talking about. So I saw some statistics, and Gavin, I'm sure some folks on this call have already seen this report that came out last year. Roughly 31% of Black lawyers said they have contemplated suicide during their legal career. 31%, I need you to take that number in so you're not weathered to it, 31%. Significant increase from approximately 23% of Hispanic and Latino attorneys, 20% of Asian attorneys, and almost 19.4% of white attorneys. Now, we know we have a broader issue, right? So as we have these conversations around the challenge of equity and what does that mean? We know mental health has been the caboose of our healthcare system. We've not provided the mental health supports, no matter where you are and what sector you're in. But I just want to remind you that the burden of disease, including mental health, is greater on certain populations. And that's what this data reveals. 31% of Black lawyers said they contemplated committing suicide. 3,200 law firm attorneys and staff asked about COVID-19's impact on their well-being and how their firms have responded. No surprise. Law firms, our legal departments, even within our corporate settings, aren't providing the sort of legal, the mental health, social supports that people need. Nearly 61% of Black attorneys said they felt isolated at their firms, compared to 53% of white attorneys and 49% of Hispanic attorneys. 51% of Black attorneys, 49% of Asian attorneys, and 49% of Hispanic attorneys, 45% of white attorneys said their firms don't offer support for personal well-being. Yeah, I don't think any of these numbers are shocking. I think, we can get into a conversation about racial isolation and representing your race and the impact that has on our mental health. We can get into all of that, right? But the challenge is 2 years into this Black Lives Matter, or this, the height of the Black Lives Matter movement, 2 years into thinking about George Floyd's murder and COVID-19 and the disparate impact that had, and all the racial justice proclamations that so many people and organizations made, it really raises the question for us as attorneys: what do we do about it now? How do we meet the moment of mental health and the challenge that it's having on Black and brown communities here and across the country and within our profession? There are so many things I think that are critical, and I'll sort of wind it down on this. So one is, there's a mental health bill in the Senate right now, state Senate. So I want you to be thinking about that mental health bill, because I worked on, Gavin, the mental health parity bills prior. I was at Blue Cross at the time. I've been here at the Mass League for 14 years. I was in the conversation that the caboose of our healthcare system was mental health. We didn't pay for insurance. We didn't treat mental health in the same way we do physical health. We didn't provide for the maximum number of visits that you could need to get care for your depression or your bipolar or your schizophrenia, all the other conditions that we can talk about. So we move the needle some on mental health, but we have so much more work to do, which is the great work that the Massachusetts Senate credit to Senate President Spilka, my good friend Senator Sear, and others are literally really leading the charge to move the needle on mental health in Massachusetts. And we still got work to do around the disparities within mental health. I'm going to wind it down on one additional comment because I could share data with you about health centers, and 70% of our patients are people of color, and the workforce challenges of trying to build a robust pipeline of Black and brown clinicians who look like the people who share the lived experiences in the communities we serve, how challenging that is, because that's an educational solve. That's about our academic institutions. That's about our grade schools, our colleges, not investing in and preparing the next generation of providers. But I want to share with you something I'm really excited about that I don't even think Gavin knows yet, that is going to be announced on May 16th. On May 16th, 40 Black and Latinx leaders who run, I won't say the swear because I'm on a call, but they run stuff in Massachusetts. That means they run hospital systems. They're deans of our academic institutions. I run the Community Health Center Association here in Massachusetts. There are more Black and Latinx leaders in the healthcare, health insurance, pharmaceutical space than we've ever seen in the history of this state. We can talk about Kevin Churchwell Children's Hospital, or Kane Hayes at Point 32, which is Harvard and Tufts health plan merged. We can talk about Dean Williams at the Harvard Chan School. I mean, Joan Reed at the Harvard School of Public Health. So many of these phenomenal Black men and women, Latinx men and women who are running organizations. We've come together in the last 6 months, and we've been meeting to talk about how to make health equity the next train leaving the station in Massachusetts, so that we center health equity. And it was where we talked about health reform in 2005, and we passed it in 2006, and we had a movement that led to the Affordable Care Act on a national level, but none of that centered health equity. None of it, I would argue, because the people who sat at the table, the people at the table were not the people closest to the pain. They didn't prioritize health equity because they didn't feel it. So when you watched Senator Kennedy and the Senate President and the Speaker of the House and those other folks standing on the stage in 2006 signing the healthcare Chapter 58, and there were some mental health pieces of that, expanded coverage, many of them were white men and white women, mostly white men. On May 16th, you're going to see Black and Latinx people standing together at Demick Health Center, announcing a coalition of us who've come together to center health equity in the Commonwealth, and make sure as we enter the next legislative session that we push forward a proposal that talks about health empowerment zones, talks about governance, and make sure that there's no entity that doesn't have Black and brown faces and voices at the table, like our Health Policy Commission is lacking a person of color. That we'll talk about how do we collect data, because we know in COVID-19, we didn't even have the data to respond to the pandemic. We didn't even have the accurate data to have the right interventions, to know how to reach people. We didn't have the workforce that reflected the community, so we couldn't convince them to get tested and contact trace. We didn't know how to reach them and speak to them. That is the work of this coalition that's come together. That gives me hope, Maida, that we can actually move the needle around health equity, and mental health is a part of that. Know that I'll be lifting up mental health. And for Maisha, Dr. Maisha Minter-Jordan, who's at CareQuest, I'll be lifting up oral health, because that's deferred care. Our eyes, deferred care, people who've not had their eyes treated, and the disparities will even grow over the next 5 years. So Gavin, those are a lot of things I threw at you, and I appreciate you having me on your last day. There's a lot I could share. There's a sage quote, a sage advice, and I'm gonna say it in a different way than it was actually said, but nothing can be solved that can't be faced. Nothing can be solved that can't be faced. This is the moment, Paulette, Rachel, that we get to face some really difficult issues. And I'm going to say this last piece on this. Lawyers got to get out the way. Because the number one thing I've heard, even in this health equity work, is every time you want to do stuff, lawyers get in this way. Well, we can't do that. Well, there's too much risk in that. Well, we'll get sued for that. And we are at a critical juncture. We need social engineers. We need revolutionary lawyers that can enter these spaces and say, what is the right thing to do? What is the equitable thing to do? And I think that all of you on this call, I know I'm preaching to the choir, but maybe each one of us can reach one. I think that movement among us as lawyers is possible. And I'm excited to join you and be part of that conversation.
Thank you so much, Michael. That was absolutely incredible. I'm so grateful for your passion, for the work you have done and are doing. I think this has been a phenomenal way to capstone our week. As many of you know, the work in lawyer well-being and legal well-being and the well-being of the legal industry really has those two components of individual well-being and systemic well-being. And I think Michael did an incredible job highlighting the many ways that the systems interact with health, with equity, and with both for our clients, for our communities, and for the profession itself. And these are just part of the reasons why Michael is being honored on May 20th by the Mass Black Lawyers Association with its Trailblazer Award and by the Jewish Alliance for Law and Social Action in June of this year. So these are well-deserved awards, and we can't thank you enough, Michael.
Thank you. Thank you.
So I've got a few questions if no one else has any, but obviously I encourage folks to chime in with questions in the chat or use your raise hand function if you want to ask a question live. So giving a moment for that. Anyone want to jump in? All right. If not, I'm thinking about some of the work of the the standing committee that we're working on, the Standing Committee on Lawyer Wellbeing, which you've heard about, and how we can address some of the issues you raised, particularly about how lawyers from particularly Black and Brown communities are struggling within their own organizations, whether it be in an in-house legal department or a firm or a public agency. I don't know if folks know about this, but within the past, first off, within the past week or 2 weeks, April 26th, the NALP Foundation released a report highlighting that of the 125 participating law firms that participated in NALP last year, there was an overall 26% of associate attrition rate. So 26% of associates left their firms. That number went up to 34% for associates of color. And then the American Thomson Reuters released a report just a few weeks ago as well, highlighting that these numbers are continuing to be staggering. Over 60% of Black lawyers in large, medium, and small size firms indicated that they were likely or highly likely to consider leaving their firm in the next year. Over 60%. So I'm curious, what do you think are some initial steps we can do to create structures that better support Black and Brown lawyers in legal organizations?
Well, it's so funny, Gavin, and I may take a different approach on this than some people would answer that question. So one is, there's some individual soul searching we need to do, because I think there's an arrogance and a privilege that so many of us in the legal profession have, particularly so many white attorneys have, to think that they were the smartest, that they were the most capable people to be in those roles. And I would say this about mayors of the city of Boston. Every mayor in the history of the city of Boston before Kim Janey assumed that of Mayor Walsh was a white male, as if no other person of color or woman was qualified to lead the city. That way too many law firms, as we look across, even today, and I've talked to Carolyn Hepsgaard about this and the Boston Lawyers Group and so many others, so many of these law firms and celebrating some recent partners of color who've ascended into some roles, but so many of them are still white men and with some increasing numbers of white women. What does that say to everyone else? And I think we send very not so subtle messages to communities when we think about, okay, when I walk into a room, I'm the only one. Does that mean that they're better prepared, better qualified, that they belong there and I don't, and I become an exception? When in fact, if we read some of the books, and I know Gavin put them in the chat, we now have to have a reckoning on how we got here. That the realities are substandard education systems that Black and Brown folks are relegated to didn't give us the same pipelines as white citizens to ascend into these law firms, to go to Columbia and Harvard and to have that trajectory to end up at Goodwin Proctor. So once we have the conversation about the taint of history in our legal profession, the taint of race in our legal profession, we have to start there, right? So let's have an awareness raising about how we got here so that we don't often walk in a room consciously or subconsciously and think, they just don't work as hard as I do. They're just not as prepared as we are. And even if you don't think in those tribal terms, that's what the message sends when you are the only one in the room. It tells everyone on the outside of the room that they don't belong, that they weren't qualified, that they're not capable, when in fact, we've left talent on the table. I'm going to digress when I make this comment, April, but I love to tell the story of Kizzmekia Corbett. So if anybody knows Kizzmekia Corbett is, she's the young African-American woman who was on the team that found the Moderna vaccine. And April, and I probably shouldn't say it on this call, was chilling in a Slade's one night. And Sheena Collier tapped me on the shoulder and said, Michael, I want to introduce you to this sister who just moved to Boston. And she taps me on the shoulder. I turn around and she goes, this is Kizzmekia Corbett, Dr. Corbett. Now, I say this, you would think I just meant Michael Jordan or, you know, President Barack Obama, because I was a groupie when I turned around and she said her name. And I said, Kizzmekia, I talk about you all the time. I said, because I tell people there is a young Black girl in Chicago or North Minneapolis or Roxbury right now that's meant to find a cure for cancer, but we'll never know her. We'll never know her because she didn't have the academic rigor, because she had gunshots outside her home, because she internalized racism and didn't think she belonged, because she's dealing with microaggressions, because she feels racially isolated. All those reasons, we'll never know that girl that's meant to find a cure for cancer. Now, I know that may sound exaggerated to some of you, but that's really how simple talent is. It lies everywhere. And yet in our profession, we've relegated talent to mostly white men and some white women with too few people of color. So we now feel our interconnectedness, that now there might be legal strategy, there might be solution to some of these complex issues. And whether you are a legal assistant in a state house writing a bill, or you're in a corporate council and trying to navigate environmental climate justice issues, or deal with a merger or acquisition, or you're trying to deal with city issues and you work for city government or state government, the reality is we don't have talent. We don't have the richness of our diversity at the table to do that kind of work. I know that I don't really want to appeal to your sense of right and wrong and, hey, diversity is good, we should do it because it's the right thing to do. Blank that. Because not everybody will be drawn to that argument. But the truth is, we hurt ourselves by not allowing these young Black, brown, poor, immigrant young people to ascend into these careers and be what they were intended to be. So I say that, Gavin, there's so much more to that point I was making, but the bottom line is I'm concerned that in our profession, we become weathered to the lack of diversity within our practices, within our firms, within the profession. And I really need us all to be unweathered. I need you to be irritated by the lack of diversity. I need you to last but not least on that, I need you to be thinking about, for the sports fans among us, I need you to be doing fourth quarter work. Because first quarter work is the proclamations, the statements, maybe the recruitment of people who are already in the pipeline. The fourth quarter work is, how do you reach that fifth grader, that 10-year-old, that 15-year-old, that college student, and say, hey, I want to get you ready. Are you mentoring them? Are you preparing them? Are you helping them with academic rigor? Are you offering to get them the support that they need, the wraparound services, the tutoring they need? Because you will say, I want you at my firm when you graduate. I'm gonna work with you from your time now to when you're ready. And whether it's my firm or another firm, I'm gonna invest in you like white communities have invested in white children for generations. But we don't have the luxury of waiting on Black and brown folks to do that. We need our allies to also do that. If you understand that inequity is a product of history, we have to be equally as intentional to change it as we were to make these conditions. That means each one of you I need to find that Black, that Latino, that Asian, that woman. I need that LGBTQ person who may not feel accepted or embraced in our environment. We need to find them, recruit them, mentor them, and coach them into this profession.
Thank you so much, Michael. Amy, I see your question. I just want to quickly respond to a couple things Michael said. First, for any of you who are looking for ways to get involved in those pipeline issues that Michael mentioned, one of the critical ones I'm involved with, and I know Michael and April have been involved with as well, is a Boston-based organization called the Leadership Brainery, which is run by two queer Black men who went to BU Law School and left and decided to start a nonprofit specifically to develop leadership skills in exceptional students from HBCUs and first generation communities to help them get into those graduate schools, those law schools, those medical schools, those business schools. So I encourage you to look them up because they're an incredible organization and need more support from folks like you. And then another very quick point. One thing you really said that struck with me is that concept of always feeling, the white men always feeling like, well, we belong in the room and someone else doesn't. One of the really interesting things I heard last week is when you think about mentorship and education, one of the really interesting things we see when you mentor others or when you supervise others who come from a different background than yourselves, there is often an implicit barrier where if you see someone else who doesn't look like you and you give them the tools to succeed and you help them succeed and eventually a whole bunch more people succeed, suddenly maybe you feel like you were less exceptional. And if we need to destroy that myth of each of us is exceptional if we're going to help all of our community and all of our profession thrive and become excellent. So I encourage you to stop, and just as I will do, I continue to try to stop thinking of myself as an amazing, exceptional anomaly in the legal profession. But I am just one of many, and we should all be helping as much as we can with the entire communities. So now I will turn it over. Amy, what's your question?
Thank you, Gavin. And thank you, Michael. I so much appreciated everything that you had to say. And your comments just a moment ago, I wrote it down because it's just, it gave me a different way of looking at things, where you said that you were talking about, the little girl, I think in Chicago, and you said, that's an example of talent that's being held back because of the internal struggles that little girl is dealing with, internal struggles which she has, they're due to things outside of her control. And that's just really so profound, and I'm going to be thinking about that for a while, so thank you for saying that. One thing I wanted to hear your thoughts on, it seems to me that we have two issues when it comes to mental health. And the first one is that I think people need to realize that they need help in the first place. Yeah. And then the second part is then, providing them with the resources so that they know where to ask or who to ask for help. And I think that we can do the providing the resources piece. I think we're doing that. That's something that we're working on now. People recognize that we need more funding for mental health and support. I'm wondering what your thoughts are, though, on how to reach especially young people, but really everyone, to just get them to realize, wait a second, I do need help. So.
Yeah, Amy, I appreciate the question. And I think that's the challenge we have, right? Is that there's a vulnerability to saying that you need help, right? So we know, we have it on the physical health side, right? People who go months with a pain and don't go see a doctor. Or who know they're having trouble breathing and don't go get it checked until it's too late, or that pain, which could have been stage 1 is now stage 4. So we know we have that, and people tend to forego their care. Now, I talk about just the choice of foregoing your care, right? But there's also lack of access, which is really a greater issue. And that's access in terms of where the hospital or the clinic or the health center is located in proximity. Your parts of Massachusetts, you have to drive an hour to get to a facility. You may not get an appointment for several weeks. You may have to pay a co-payment or a co-insurance and the impact of that. So we're talking about generally in the healthcare system, that the accessibility barriers that prevent people from getting care, physical or mental health or substance use disorder. So one, we got to solve for that, and that's real. Stigma is another one. I know way too many families, and this is, I could talk generally and then about race. because I can go back to the Black don't crack, but the cracking's on the inside. We as Black folks and people in color in general, but I'll speak from the Black experience, have been taught to not let anyone see us crack. I can't let you see me struggling at work. I could lose a family member. I can't break down and cry at the office. I can't come in when my relationship is struggling. I have to always be on point when I'm showing up as a Black person in this organization. And there's a toll that we pay for that. So part of that is, when can you just say, and we, in the Black community, we tend to say, oh, white folks going to get therapy, right? And it's sort of like a thing to say, oh yeah, that's what they do, when in fact, that's what we should be doing too. But the stigma has been, we have to be so strong. And that, I would equate that to when white communities, J. Marion Sims, who experimented on slaves during the 19th century, one of his arguments when he experimented on Anarcha, Lucy, and Betsy, 3 African-American slaves, was that Black people have higher thresholds of pain. And then you go forward to the early 2000s, a study came out in Philadelphia that said that physicians in training still had that same belief that Black people have higher thresholds of pain. That's not just physical. People think that we can just endure and survive these circumstances. So that's general society. People have a stigma. They don't get care. They don't come in for care because they think they have to be able to resolve it on their own. And by the way, if you had a broken knee, right, a tear in a part of your organs, or you had cancer, that's depression to schizophrenia, right? But we've not made and equated that the way that people can take that in and say, no, it's normal. That if you've been struggling with the loss of a loved one, or the violence in your community and it's traumatic, or whatever, internalized racism, or police violence, or community violence, it's okay to say, I need help and I need to come in, I need to get services. That's one barrier, is the stigma part. And then the other barrier is whether you can get services. Because if you're Black or brown in Massachusetts, in Boston right now, and you want to go see a provider, you're going to be limited if you want to find somebody who's culturally competent, who knows. So I won't have to explain my faith relationship to you, right? I'm a Baptist. I won't have to explain what it's like to be Black and to feel isolated or marginalized or profiled. We're not talking about police profiling. We're about profiling at the office, right? Right. I won't have to explain it to that physician, because that clinical provider, psychiatrist, psychologist, licensed clinical social worker, because he or she knows me. You can't get that in Massachusetts right now. Now we can create examples of people who've gotten access, but writ large, you can't make that call in Massachusetts because the pipeline's not there, the systems are not there, the panels of the folks who already have, who are competent, who are diverse, already are full. So we have a lot to solve, Amy, and I'm not sure what all the answers are, but we gotta be policy minded, right? And we gotta be bold and courageous to say, I want 5 million ARPA dollars into high school students entering the mental health profession, right? I'm just making that up top of my head. And then we need to go to Senator Sear and somebody on the House side and say, I need you to file a bill, and we're gonna mobilize around it, and we're gonna provide services. We don't do that really. We wait for them to come up with ideas. And quite frankly, when you think about the 200 people in that building, or the people who sit in the corner office, they don't often have that lived experience. So we're waiting on somebody when that somebody is us.
Thank you, Michael. April?
Good afternoon, everyone. As always, thank you so much, Michael, for everything that you shared with us, taught us, and helped us with. Gavin, I want to speak to the exceptional piece. It's interesting because at the Attorney General's office, when we did our mandatory unconscious bias training, Dr. Professor Banaji from Harvard specifically stated that in postings, there is particular language that deters women and people of color from applying. And it's superlative, so it's exceptional, it's superior. We don't necessarily view ourselves as either one, but a white man may have done the job for maybe like 5 months and we'll be like, absolutely, I am exceptional, I am superior, I am the one. So it's interesting to hear you talk about that. Michael, to you, in terms of the lawyers, one of the things that AG just said this morning in talking about what is happening to the dismantling of constitutional rights for those who are most impacted by it, she said, we have to be creative.
Yes.
And I would say to her, well, Michael said that we also have to be passionate.
Yes.
And so I think it is a combination of the two. We have to be creative and passionate. You also took my life when you talked about the Black don't crack, and you then talked about the cracks. Oh, I don't even know how I move on for the rest of my day with that one. So thank you for that. You also
Right.
enlightened me about the diabetes issue, because, and I will share this with everyone on the screen. Last year, I was like 1 point over, right? But I wasn't in the diabetes space. But there's like some numbers that are in between that last year I was fine. There was no like warning you're in pre-diabetes, nothing like that. And so it's interesting to hear you talk about that. No, last year I was 2 points over. This year I was only 1, and I got the pre-diabetes warning. And I was like, why? I'm actually 1 point lower than last year, but it makes sense that during COVID, people were not being diagnosed. And so now there's more of a warning with
Yes.
these numbers that were never touched before as a warning are now coming back as warnings, even 1 point over and 5 points from when you could be diabetic. So I appreciate you putting that into perspective for me also. And thank you so much for spending so much time on the impact, the mental health impact that it is having on communities specifically that look like me, in our kids, in our youth, in the suicidal rates that are impacting our communities at extremely high levels. Because if there's not racism, there's inequities. If there's not inequities, there's a police shooting. If there's not a police shooting, there's COVID, right? So it's everything that comes together, and it cracks us absolutely. So thank you for that.
Thank you, April. And, just a quick response, Gavin, to some things April said. So one, April, I gave you a shout out to the Attorney General because I told her, I said, who you hire matters, right? When we Black and brown folks, people who are marginalized, Gavin, we watch who you hire because that'll say a lot, right? And they don't, just because you hire somebody that has the same skin color or our same sexual orientation or gender doesn't really matter. It's about who you hire and their politics and their passion and their commitment to justice. So I said that to her because that's for her message now and in the future. But you said something that I also wanted to speak on, which is disruptive. There's an importance. None of these systems change unless you're disruptive. And as I said to her, and I would say to all of you, we won't get any of these things fixed, not health inequities, not educational inequities, not housing inequities, if we're not disruptive. We have a tendency in this country and across the globe, but particularly in this country, to think we can change things incrementally. Throw a few dollars at it, do things in pockets. That will not change the conditions of many people in this country. So I say, as we have this conversation, even in the mental health space, we got to be disruptive about how we reach people with resources, how we provide access to care, how we make it affordable. And we got to understand that there's repercussions. One other thing I'm going to share with you, in addition to this group that's coming together, an announcement on May 16th is one of the other things, the Blue Cross and Blue Shield Foundation, and don't put this on social media yet because it's not announced yet, but Blue Cross Foundation has committed to doing what we call the cost of inequity report, Gavin. I don't know, we've never had a report like that in my recollection in Massachusetts that will, for the business case around inequity, say what it means when your Black and brown staff are on paid leave, are taking sick days because they're dealing with disease or dying early. They're not in the workforce, and we're already dealing with a workforce crisis. What does it mean as an employer when you have higher insurance premiums that you're contributing to because your Black and brown and poor and marginalized folks are disparately sick? Or what it means when Black and brown folks show up in the emergency room or in inpatient days to get their disease treated at a hospital. And all of those are cost impacts that we all bear the burden on in our pockets. And the state bears a burden on the state budget and city budgets. So the Blue Cross Foundation, to their credit, this time next year, probably February next year, we'll be releasing a cost of health inequity report in Massachusetts. I would love, I know I can call Gavin and tell him the issue, and Gavin's going to be right next to me on the front lines. There are some folks that the motive appeal about people dying is not going to move them. Dollars move them. Dollars and cents move them. As a policy person, I don't really care what moves you. I need to pull every tool in the tool belt to convince you that you need to show up. So that report's going to be critical.
Thanks, Michael. Anyone else have any questions? If not, I'm happy to close things out. But if you have any while I'm talking, please feel free to jump them in.
Gavin, I just want to really quickly say thank you to you for coming to the class. And I just want to just mention that New England Law Boston invited me late, I think November, December, they called me and they said, we need you to do a class. And we want to do something around diversity and inclusion in the legal profession. And I teach at Suffolk, but not in the legal profession, more of a healthcare management course. So I had to pull something together, and you'll appreciate, Gavin, Ryan, U.S. Attorney Rollins, Carolyn Hepsgard, so many people came through. Sharice Perry came through. We had probably a good 10 guest speakers. Sincere, the brother who served 20 years in prison, came through. Attorney Jerukum came through. And I'm going to try to do that class, and maybe in the future, and allow these students to understand what their decisions as lawyers, how those decisions and how they show up at work impacts a people. So stay tuned for this class, because I think, I know April, Sharina Clark, Danella Clark's daughter, teaches that comparable class at Suffolk Law School as well. And she's a mentee and friend of mine.
Awesome. Thank you, Michael. And thank you again for that opportunity. It was definitely one of the highlights of my year. So thank you all for being here with us today. For those of you who are here throughout the week, thank you for being here throughout the week. I'll let Heidi close things out for the end of Wellbeing Week in Law, but we are grateful for all of you who showed up, and unbelievably grateful for Michael being here with us today and closing us out with such inspiring, actionable, and powerful words. Heidi?
Yeah. All right. So we're Friday here at the end of Wellbeing Week in Law, and I just, I want to say that I was very inspired by Michael's passionate and illuminating remarks today, and I just feel like it is such a wonderful way to wrap up this week of Wellbeing Week in Law. I think, as folks know about the work that we've been doing with the SJC committee, we know that these ideas that Michael has been speaking to need to be a foundation to and really ingrained in our work. And so, we encourage folks to read the books that Michael recommended, the ones that Gavin posted in the chat. And in addition to educating yourself, but particularly for the white folks here, like myself, learning how to be an ally, and as Michael said, disrupting the system. I think we have a lot of work ahead, as we all know. We hope that you all join us in our efforts. And I see many of you here who have been working on so many of these issues. Also, recognizing the disproportionate impact of mental health on the BIPOC community, which was spoken to today, and looking out for others is really important. And so as we wrap up the week today, we hope that you were able to attend at least one program this week and got something out of it. Part of the purpose to this is really to create more awareness around all of these issues, well-being in the law and how it impacts all of us. And so we invite you to continue to be involved with our committee. I see folks from the Mass Bar Wellbeing Committee to be involved with the Mass Bar Wellbeing Committee, to be involved in Lawyers Concern for Lawyers, and to reach out when you need help. So with that, I hope that everyone has a wonderful weekend, and I hope that we see everyone soon. So nice to see folks here. And by the way, this will be recorded and we will post it, and we hope you will share it with your peers and your colleagues. So thanks, everyone. Take care.
Thank you.
Thank you so much.